Healthcare in Australia is changing largely as a product of our changing population. So we're going through unprecedented population growth. So by 2051 we expect that the population will be about 4 million people larger than it is now, and that's just in Victoria. So that also comes hand in hand with the fact that people are now living longer, which is a wonderful thing, but it also means that people are tending to live with chronic health conditions, which has an impact on the demand on our healthcare system into the future. We also know that not all cohorts of our population fare the same. Some do it tougher than others. We know that, for example, poorer health outcomes are linked to levels of poverty, to low education levels, and even within that, people with, for example, disabilities, mental health illnesses, members of our Victorian Aboriginal community and our coal communities have particular difficulties and challenges and around accessing healthcare, but also around making sure that healthcare is appropriate to them. So in terms of how we look to adapt to that into the future, we need to really make sure that our healthcare system is responsive to the needs of our community, and that those all different sorts of people across our community can access healthcare when they need it and where they need it, and in a culturally appropriate way. There's sort of three aspects to this, I think. There's better healthcare, better access, and better care itself. And when we talk about better health, we're really talking about prevention and early intervention, and this is around allowing people to take control of their own healthcare really before problems or serious problems arise. That's a really important part of what we can arm our community with to ensure that our general health is better. In terms of better access, we want to ensure that nobody waits for healthcare longer than is clinically advised. This is about giving people access to healthcare when they need it and where they need it. And in terms of better care, that's really around quality and safety and having sufficient safeguards, and also about arming our workforce and training our workforce to ensure that they can provide the best possible healthcare to all Victorians. I think the benefit is that it forces people out of their silos, it encourages collaboration, it gets people talking to each other and sharing ideas, and any forum that can do that and can get the best and brightest minds from a range of different sectors, turning those minds to common problems, you're ensured great outcomes from that process.